Hello, my name is Stefan Rodriguez. I'm gonna talk about tick attached to the tympanic membrane. First, definition. Ticks are arachnids typically 3 to 5 millimeters long, living by feeding on the blood of mammals, birds, and sometimes reptiles and amphibians. Ticks are vectors of many diseases that affect humans and other animals. Some ticks carry pathogens that can cause human disease, including anaplasmosis, Lyme disease, Rosawan disease, and tularemia. The
Is there a
video
tripling in the amount of diseases from these suckers, as Dr. Shives says?
Well, we have more of them. The ticks are spreading, they're spreading their ranges, and that's due to a lot of different factors. Some of it has to do with weather, some of it has to do with human behavior, a lot of it has to do with hosts, like all those deer and rodents that are out there. They are perfect reservoirs for the ticks to feed on.
Do ticks die over the winter?
No, they survive over the winter. They can hang out under the leaves and then come out as soon as the snow melts.
Is Lyme disease still the most common tick illness?
It is in the country, and particularly in the upper Midwest and the Northeast.
Some 300,000 cases a year, right?
Yeah, more than that.
Really?
Mm-hmm.
But when we were a decade ago, a couple of generations ago, no, I'd never heard of Lyme disease. Is it because it had not been diagnosed yet, or because there was no Lyme disease at that point?
There was some disease, so it had been diagnosed by then, but there wasn't a lot of it. There weren't as many forested areas where our deer used to like to hang out. We used to be more of a farming society. There used to be wider areas that were just open fields for crops. Now we have all these nice wooded areas that the deer just love, the rodents just love.
Then applications in medicine. There's a case, 9-year-old boy in Connecticut who was taken to the doctor because he said he felt like there was something in his right ear. The boy had also reported hearing buzzes, noises on his ear and a few days early, but didn't have any ear pain or trouble hearing. The cause of the body's trouble were made immediately clear. However, when doctors looked inside his ear and spot a stick lodged into his eardrum, they also noticed that the surrounding area was inflamed. The body needed to be transferred to an operating room so doctors could attempt to remove the blood sugar while he was under general anesthesia. Doctors used a hook-like instrument to remove the dead tick. It was later identified as an American dog tick, the Dermacentor variabilis. The boy received antibiotic ear drops to prevent an infection from developing.
When you think about Lyme disease, you probably think of this, a tick, or maybe more specifically, a tick bite. But what exactly is it about a tick bite that makes us sick? This is Borrelia burgdorferi, one of many bacteria that ticks can pass on to humans and the one responsible for Lyme disease. It causes an array of symptoms, which can be anything from fatigue, arthritis, facial palsy, and occasionally a bullseye rash, erythema migrans if you want to get technical. We've only known about the pathogen since the early 1980s, but it's been around for much longer than that, potentially for thousands of years longer. Traces of its effects were even found in Ötzi the Iceman, the 5,300-year-old hunter found mummified in the Italian Alps. But while we're not exactly sure where and when Borrelia originated, we do know a lot about how the disease works and how it spread.
I should take my glasses off. My name is Raphael Stricker. I'm a medical doctor. I practice in San Francisco. I have over 4,000 Lyme disease patients in my practice, and I've written more than 200 papers about Lyme disease. Ticks have been called sewers of infection. Anything that they feed on, they can pick up and transmit to you.
These sewers of infection need blood to survive. Sometimes that's bird blood. Sometimes it's reptile blood, but a lot of the time it's mammal blood, like mice and deer. If a tick feeds on one of those animals and they are infected with the bacteria, the tick will carry it and then spread it to other animals, who then spread it to other ticks, and so on. Occasionally, those ticks spread the disease to us, and they do that by passing the pathogen through the tick's saliva, which some people call a pretty fascinating substance.
Ticks
Pros and cons. Pros. Tick attached to tympanic membrane occur rarely. The tick species cause dermatocele borealis. Cons. Tick can cause limb disease and tularemia. Tick's bite produce symptoms as a red spot or rash near the bite site, a full body rash, neck stiffness, a headache, nausea, weakness, muscles or joint pain, and fever.
Lyme disease is an illness that's caused by bacteria carried by infected ticks. If you've been bitten by a tick and show any of the early symptoms of Lyme disease, you should see a doctor. Lyme disease has 3 stages: early localized, early disseminated, late. Early localized stage Lyme disease. Typically, a large raised red spot, or erythema migrans, appears at the site of the bite, usually on the thigh, buttock, or trunk, or in the armpit. The spot usually disappears after about 3 to 4 weeks. About 25% of infected people never develop, or at least never notice, the characteristic red spot. Early disseminated stage Lyme disease. This stage begins when the bacteria spread through the body. Fatigue, chills, fever, headaches, stiff neck, muscle aches, and painful swollen joints are common. In nearly half of people who are not treated, more, usually smaller erythema migrans spots appear on other parts of the body. People have a backache, nausea, vomiting, sore throat, swollen lymph nodes, and an enlarged spleen. The nervous system is affected in about 15% of people. Common problems are meningitis and Bell palsy. About 8% of infected people have irregular heartbeats or arrhythmias, and inflammation of heart tissue, myocarditis, and the sac around the heart, pericarditis, with chest pain. Irregular heartbeats may cause palpitations, lightheadedness, or fainting. Late-stage Lyme disease. If the initial infection is untreated, other problems develop months to years later. Arthritis develops in more than half of people, usually within several months. Swelling and pain typically recur in a few large joints, especially the knee, for several years. Cysts may develop and rupture behind the knees, suddenly increasing the pain. A few people develop abnormalities related to brain and nerve malfunction. Mood, speech, memory, and sleep may be affected.
Issue applied in Ecuador. The first reported case of Lyme disease in Ecuador was in 2004. Lyme disease transmitted by ticks that contain the Borrelia burgdorferi species. Reported in a 12-year-old patient with symptoms of headache in the frontal region of great intensity, more intense in the mornings, of pulsatile type, malaise, photophobia, and phonophobia. Hyperemia of 37.8 and abrupt decrease in vision, taking into consideration their absence and their clinical picture, and that suggestive neurological images. We thought about Lyme disease, requesting the LISA test for Borrelia, the result positive.
A warning tonight about ticks. We're seeing more and more of them already. 27 First News reporter Brittany Bissell today talked with an expert about tick season and how to protect yourself and protect your kids. Brittany joins us live in the studio with what she found out.
Good evening. Tick season is here, and don't be surprised if you see a lot of them this year. Today, I found out what you should be looking out for during the warmer months. Sunshine and green grass. Spring is finally here, but the warm weather brings out ticks. I talked with a local expert who says they aren't just in highly wooded areas.
It seems to be recently that the tick population, because we've had warmer winters, is even going into front yards, backyards.
Because ticks are found closer to home, the number of bites are going up. The CDC shows a record number, nearly 60,000 cases of tick-borne disease in 2017.
At this point, because because we've had consecutive years of a thriving tick population, and even mosquitoes for that matter, just to be more cautious, even if your children are playing out in the front yard, when they're coming in, checking in their clothes, checking their hair.
One of the most common disease spread by ticks is Lyme disease. There were over 200 confirmed cases in Ohio in 2017.
Finally, conclusion. Being in a country with warm regions, there is a high prevalence of ticks causing disease constantly to animals and humans. Ticks can transmit very serious disease such as Lyme disease and tularemia. People should be careful when in contact with animals, and in case of having a pet, the animal should be constantly dewormed to avoid tick bites.
Hiking has so many benefits. It's health. Tick-borne diseases are on the rise. Cases of Lyme disease in particular have almost tripled in the last 2 decades in the U.S. Why are there so many more ticks in the country? Researchers point to climate change as one of the main reasons. Lyme disease is the most common vector-borne disease in the U.S. The bacteria typically lives in mice, birds, deer, and other animals that ticks like to feed on. But it finds its way to humans when infected ticks casually latch onto them in wooded areas. Though in most cases, the tick must be attached to the skin for 36 hours or more for the disease to be transmitted. Lyme disease has a variety of symptoms at various stages, including fever, headache, fatigue, muscle and joint aches, and the classic bullseye rash. Catching the disease early is crucial so antibiotics can be used to treat Lyme. But if it's left untreated, the infection can spread to other parts of the body like the heart and the brain, and the effects can be much more dangerous. In some cases, though, the disease can mysteriously persist for years, even after treatment, and researchers haven't figured out why. Lyme can be incredibly hard to diagnose, but all kinds of ticks don't make you sick.